So I think we'll get started. Welcome everybody to our panel. Let me see, I'm going to change where this is. I'm excited to have all of our panelists here today for this panel on climate change and mental health. My name is Leah Wen. I'm the program manager for the UW Consortium for Global Mental Health. And together with the Population Health Initiative, I've been organizing these monthly speaker series. So we're really excited and honored to have our panelists here today. And I want to start with just a land acknowledgement. For those of you joining us online and not in the Seattle area, just kind of think about where you're at. And for everybody, just maybe take a moment to quiet yourselves and think about the land underneath our feet, down below the building, the air outside, all the beautiful things around us in the world. The University of Washington acknowledges the Coast Salish peoples of this land, the land which touches the shared waters of all the tribes and bands within the Suquamish, Tulalip, and Muckleshoot tribes. And I acknowledge that my connection to this place is made possible by the indigenous people who have loved and cared for these lands for millennia, these lands and waters for millennia. I specifically thank the Achuapsh people, the people of Achu, or Lake Washington, which is where I live and enjoy the land the most at this moment in my life. Let's see. Oh, I have to be in like lots of places at once. Sorry, guys. Here we go. Okay, no, not quite yet. All right. So I just want to first introduce Kristie Ebi. She is a professor of, and she's joining us online. Kristie Ebi is online, is a professor of University of Washington in the Department of Global Health and a professor in environmental and occupational health sciences. She is also a professor at the Center for Health and the Global Environment. And then Sara Curran is in the room with us and is a professor at the University of Washington in the Department of Sociology, and also a professor at the Jackson School of International Studies and at Evans School of Public Policy and Governance, and adjunct professor in global health. She is director of the Center for Studies in Demography and Ecology and the UW Associate Vice Provost of Research. And like I said, Dr. Curran is in the room with us. Gregory Bratman is also in the room with us and is adjunct in the School of Public Health and Department of Psychology, and is an assistant professor in environmental and forest sciences and director of the Environment and Wellbeing Lab at University of Washington. Sherilee Harper is online, and once our slides are down, you'll see our panelists even better in the room. Sherilee Harper is a professor of public health at the University of Alberta, Canada, and Dr. Harper is a Canada Research Chair in Climate Change and Health. Susan Clayton is also joining us online and is the Whitmore Williams Professor and Department Chair in Psychology at the College of Worcester in Ohio. And then Vic Satz is our final person in the room and is our moderator today and is a doctoral candidate in sociology. So thank you all. And with that, I'm going to hand it over to Susan, who is going to give us an intro to our topic. There you go.
Hi, please let me know if you can't hear me. I want to thank the organizers for putting together this panel. I think it's such an important topic and a relatively underemphasized and under-recognized one. I would say really it's only been about 10 years that people have given serious attention to the idea that climate change does have an impact on mental health. And we're certainly still every year expanding our understanding of some of the ways in which that happens. So we thought it would be useful for me to just run over, for those of you who haven't thought about it maybe before, what do we know? What is the framework for how we think about the impacts of climate change on mental health? And I've put up 4 categories on this slide. I think it's very easy for most of us to imagine that acute events like storms and wildfires can have an effect on mental health. And we certainly do see increased levels of PTSD, depression, anxiety, substance abuse, things like that following those storms. Rapidly growing body of evidence looking at some of the more chronic changes associated with climate change and how those impact mental health. Especially we see evidence that increased levels of heat can have an impact on our mental processes and are associated, for example, with increased psychiatric admissions. The indirect impacts of climate change are extensive, and many of those indirect impacts are also likely to have effects on mental health. I singled out here particularly involuntary displacement, so people who have to leave their home and often their social context because of, say, rising sea levels or thawing permafrost or drought or other reasons that their homelands can no longer support them. Also, the physical health impacts of climate change, which are extensive and can be severe. And of course, the economic impacts of climate change, as your job might be threatened or you might experience economic loss associated with your home. And each of these indirect impacts is associated with threats to mental health. And then really just in the past few years, increasing understanding that just our worries about climate change, our perception that it's occurring, our anxiety about what kinds of threats the future might hold, also have a potential for undermining mental health. So those are that's the background for, I think, having this panel. If you could move on to the next slide. I want to highlight two qualifications. One is the emphasis on inequity. So we know that not everybody is equally affected, not everybody is equally vulnerable. So definitely both within countries and across countries, you see very different experiences and threats to mental health associated with climate change. But also the fact that the mental health outcomes are not determined solely by the impacts of climate change, but also by other factors, including sources of sport, gives us a sense that it is possible to mitigate and remediate some of these potential impacts. So that's why I say it gives us hope. The mental health impacts are not, there are things we can change. And on the last slide, I won't read through this, but it's just a diagram that shows how a number of these factors fit together. So in the middle, you see the kinds of impacts on mental health, including not just mental illness, but also emotional and cognitive well-being, threats to social relationships, and just negative emotions. Those are the mental health outcomes. They're contributed to by the hazards we experience, the extent to which we're exposed to them, and our vulnerability to those hazards. But also they can be mitigated by some of these factors you see in the outer circle. There are things we can do as individuals at the community level and at the governmental level that will tend to reduce the threat to mental health posed by climate change. And that's my overview.
Great, thank you so much, Susan, for that orienting introduction to the topic of our panel today. Before we get into the questions for our panelists, I wanted to give each of our panelists a chance to introduce themselves to the audience and give a brief description of your research. So let's start with the folks on Zoom. Let's go back to Susan, and I believe she has a slide accompanying her introduction, and then maybe we can go to Sherilee and Kristie, and then Sara and Greg in the room.
Yeah, so I just wanted to point out that my training is as a social psychologist. So although I'm certainly very interested in mental health, I tend to view that very broadly as one part of well-being, that there are social interactions and there are cognitive functions that are also part of how I think about mental health. My research emphasizes the ways in which people interact with the natural world. And particularly my work is focused on psychosocial impacts of climate change, more broadly, how people are impacted by their environments, both healthy environments, so healthy natural settings, and also, of course, degraded environments, such as those that might be represented by climate change. Currently, I'm particularly focused on the idea of climate anxiety, people's worry and concern, and maybe even impairment associated with their perceptions of the impacts of climate change, how this might affect their behavior both currently and their plans for the future, and of course also how do people cope with these threats, and what can we do to enhance sources of resilience? So I'll pass it over to Sherilee.
Okay, hi everyone. I'm calling in from Edmonton, from the University of Alberta, which is on Treaty 6 territory. I wanted to tell, in my introduction, I wanted to tell a bit of a story about my work. I'm trained as an epidemiologist, and I do participatory research with communities. But I wanted to tell you a bit of a story to give you a sense of where I'm coming from today. My climate change work started when I was a grad student. Dr. Ashley Consolo and I were students together, and we still work together now. We were working with Inuit in a region called Nunatsiavut in Canada, and we were trying to understand the lived experience of climate change impacts on Inuit people's health. The Arctic, of course, at that time was already experiencing climate change impacts. And back then, elsewhere in the world, you might have been discussing whether or not climate change was actually happening, but in the Arctic, you could see the changes with your own eyes, and everyone was talking about it. At that point in the literature, most of the focus was on climate change impacts through heat waves, impacts on vector-borne disease, and a little bit at that point on food and water-borne disease. So when we were talking to Inuit, that was what we were expecting to hear. And they did talk about that. They talked about how the ice wasn't safe as it used to be. And so it was harder for them to, harvest local foods that people rely on. But they always kept coming back to talking about how it made them feel. And at first, when we were doing these interviews, we kept on trying to steer the conversation back to things like food and water safety and safety out on the ice. But people kept on circling back to how things were, these impacts were making them feel. And then when we asked them, to elaborate on the injuries on the land due to unsafe ice, they would talk about the stress that caused. Or when we asked them to talk about food security impacts, people would share about how the inability to hunt impacted things like their cultural identity and sense of self. So they really talked about how their experiences with climate change were also amplifying previous trauma from things like residential schools. And so the more people, kept on circling back to mental health, even though there wasn't much in the literature at that point about that, we started to really listen and learn about it. And that really changed our whole program of research. And for both of us, that's when we really started focusing on how climate change impacts emotional health and mental health. And since then, I've become really active in the IPCC community. And it was so exciting in this last assessment cycle to see climate change impacts on mental health for the very first time, to be able to have an assessment, an in-depth assessment on how climate change is impacting mental health in an IPCC report. So that means that in my own short career, I went from not seeing very much in the literature at all and really being hesitant about whether or not this is actually a thing or a phenomenon that exists, to a place where there's so much literature on the topic, or emerging literature on the topic, that there's enough research for the IPCC to actually assess it. And for me, if the IPCC is assessing it, that means it has the potential to inform international decision-making in real ways. So that's just a little bit about the story of my own path into this area, and also gives you a sense of the type of research that I do and the type of research questions that I work with communities on. Thanks.
As you heard, I'm Kristie Ebi. I'm a professor in the Center for Health and the Global Environment. I've had the privilege of working on climate change for 30 years, and it's been really inspiring to see the work that Susan and Sherilee have been doing. I've worked in many low and middle income countries, and so I've not directly worked on mental health issues, but indirectly with working with communities, particularly the work I've been doing in the Pacific, and seeing the kinds of challenges that communities are facing. That really the long-term option for many of them are going to be to move. I've also done a little bit of work in the Arctic, much less than Sherilee has done, and working with these communities and just seeing what they're experiencing and knowing the challenges they're facing and recognizing the mental health issues. And then closer to home, been doing work on extreme weather and climate events. Sherilee can talk more than me about wildfires, Fort McMurray, and what that means for mental health. And so all of us engaged in this field are doing more research, more interaction around issues related to mental health. And it's wonderful to have professionals involved who know a lot more about mental health issues than we do. We're learning as we're going. Thank you.
So I have been working, I'll start a little personal history as well. Like Chris, my work has not been directly about mental health, but more about issues of settlement, migration, family dynamics in mostly in low and middle income countries, and more recently now looking at the United States and transformations and dynamics resulting from climate change and events on climate related events on communities. But to go back to the way back time of maybe 30 years ago when I was doing my dissertation research in Thailand, at the time I went there to look at economic development and patterns of migration and education in northeastern Thailand in a villages, a district where they were dependent on rain for their rice crops, and they would typically grow. Definitely, they would grow one crop of rice. Sometimes they could get 2 crops in one season. And it was during my field work when I was asking questions about why are people migrating and what are people doing about investing in education and et cetera. And I was also hearing from villagers about the fact that the rain that used to come on a regular cycle, monsoon rain to irrigate fields, was vital for growing rice. And this area was known for having the best, highest quality rice in the country, was increasingly uncertain. The timing and arrival of rain was uncertain. The amount of rain that would come was uncertain. And this was leading to people migrating frequently to make the children leaving to earn money, to smooth incomes. And so I wrote a dissertation on something else, but I got very interested in this dynamic. And subsequently did some research where we looked at these patterns of rainfall, especially El Nino, La Nina events, as well as actual rainwater, rain gauge collection, and tried to measure drought and the impact of drought. And one of the things that we learned in that work was that increasingly it wasn't just one season of drought, wasn't 2 seasons of drought. It was more than 2 seasons of drought before people actually picked up and left a place and gave up on a place. They really cared about their place and their home, and it was really important to them that they stay there, that their children stay there, and that their grandchildren stay there. And that notion sort of stuck with me, and I, as the research was coming out in the 2000s about migration and the impact of climate on migration, lots of people talk about climate refugees, and there's like a lot of worry about climate refugees, but the data wasn't showing it. There wasn't that much data to indicate that. Part of it was that there wasn't research. I mean, the study designs were able to capture it. But the other part of the story is also that people may get displaced, temporarily, but they go back. They want to go back to their place. They don't want to leave. I mean, that is their primary source of social, human, natural capital, wealth. It's hard to give up in many places of the world, actually, to leave. So I'm really keen to hear what everybody else has to say, but I think that thinking about this notion of dislocation and disruption and having to leave is something that is that indirect effect on mental health. one of the concepts more recently in recent decades, or recent last, maybe 5, 6, 7 years has been the idea of managed retreat, that somehow we can pick up people as a community and relocate a whole community. Now, that hasn't really been done systematically, consistently. There are a few places where that's been done. It has mixed. It's not clear what the results are of having picked up a whole community and relocated them. There are some examples in the US. I'll mention also briefly that some research that I've been doing with a colleague at the University of Minnesota looks at the hurricane events on county population since 1970 to 2020. And what we find is that you may have a temporary dip in the population growth rate, population size, but you actually don't have that much of an effect in the long term. So by 10 years out from an event, your population is back to where it was before at the same rate of growth. And so maybe there's a signal there about adaptation. Also, the same signal of wanting to hold on to a place. Now, not all places are the same. Some places get hit by more than one hurricane, and that certainly has an impact. But just to say that this importance of place, I think, is highly relevant to the notion of mental health.
Thank you, Sarah. My name is Gregory Bratman. I'm grateful to be here on this panel with so many different perspectives on this issue. I come from, I'm the director of the Environment and Wellbeing Lab. I'm also the director of UW Nature and Health, which is an initiative under Earth Lab. And broadly speaking, my work takes a kind of Western science perspective and uses those types of methodologies and assessments, almost in a medical model type of approach to look at how nature experience benefits psychological well-being. And so given that approach, the kinds of outcomes we look at are, for instance, stress reduction. So engaging with natural environments on different scales and how that tends to lead to reduced stress in ways that we measure in certain ways. Validated self-report, physiology, like heart rate variability or blood pressure or skin conductance, other correlates of stress, cortisol levels. We also use an environmental psychology theory that called attention restoration theory, which sort of posits that natural environments tend to restore what we call directed attention, which tends to be depleted in, among other things, urban environments. And we can measure that using working memory tests, cognitive function tests, other things like that. And there are other kinds of outcomes and pathways that we examine as well, including emotion regulation, the tendency of urban green space to provide opportunity for physical activity, and even how being in nature can have a restorative effect on social interactions, and in some cases, perhaps increase social cohesion in a neighborhood. So we look at that evidence, we try to, in my lab, we run experiments, or we use a variety of methodologies to try to tease apart causal mechanisms and pathways. And with this body of evidence, which is really growing, we also look to figure out ways to operationalize that evidence and bring it into tools or frameworks, conceptual frameworks that can inform decision-making and urban planning. And increasingly, there's an interest in how this can relate to the context of climate change and the challenges that presents for well-being. So I'm looking forward to hopefully speaking more about that. But it's the context of the work I do.
Great, thank you, everybody. So given that this is part of the Global Mental Health Speaker Series, I wanted to start things off with a question about how you approach the question of equity when it comes to research about climate change and mental health. So this is a question that anybody can answer, but let us start with Sherilee online.
Yeah, I'm sure that's it's an interesting question because it's something that I think a lot about very often. It probably isn't a surprise that I think about that because I'm working with Indigenous communities on this topic. And so equity is always at the top of my mind. Equity in terms of the inequitable experiences and the injustice of it, equity in terms of the responses to, you know, adapting to climate change, equity in terms of the knowledge systems that are considered when we're doing things like assessing the science through things like IPCC. So I guess equity underpins everything that I do and everything that I think about. And yeah, I think climate change in general is one of those things that is inequitable. And it definitely is the case in the context of how climate change impacts mental and emotional health.
Consider Chris want to say, I'll say that, I'm a sociologist, I don't think I mentioned that, but as a sociologist, that's sort of our driving, question of equality, inequality, stratification is something that's at the core of our discipline. And, you know, how it comes about, what are the mechanisms that it mitigate or exacerbate, and how do we not be so stratified, or whether it's okay to be stratified. But the question, so in my mind, I'm thinking about inequality at many different scales. So whether it's where you happen to live, whether your income is lower than another person who may be able to adapt, it may have the resources to adapt. But the way we organize society generally in most places in the world is inexorably unequal in all sorts of social dimensions, whether that's gender, race and ethnicity, income, wealth, and all of those intersectional inequalities you know, result in unequal impacts, mental health impacts certainly, as a result of climate change. So in my view, it's part of it's there from the get-go, just because of the nature of social relations at all levels of organization.
I'll say one word and then let our other panelists join in, but yeah, so those tools I talked about developing, a major purpose of them is to try to address in some way health inequities that stem to some degree from unequal access to nature. And so, you know, as we find out more and more about these benefits that we gather the evidence for, it's critical that we figure out ways to maintain and increase access for nature and nature's benefits to historically marginalized communities. And some of these communities are the same ones that are also face some of the greatest challenges that climate change presents, such as urban heat island effect, increased air pollution, wildfire smoke, say. And so we also think about one way in which we frame these results is as psychological ecosystem services. And we could talk about the ecosystem service paradigm and its benefits and challenges, but that allows us to talk about kind of co-benefits that can happen from, say, installing green infrastructure in a community or increasing green space and access to green space, and the kind of win-win-win situation that we can have there with reducing the urban heat island effect and to some degree reducing air pollution and potentially providing these psychological well-being benefits. So that's the context in which I try to put this work to work.
And I'll add to that it's often challenging. It's not challenging to identify the poor and the marginalized. But most poor and marginalized communities are poor and marginalized for a range of reasons. Political reasons, social reasons, cultural reasons. And as researchers, we have responsibilities then to think through how one represents these communities when talking with different levels of governance. Thinking, for example, of some projects I did in West Africa, and then thinking about how to represent these communities to the meteorological services. that we're not really servicing these communities. And it does require moving beyond the kinds of statements that everyone made, which are all extremely valid, to the actual how. How do you do this in these situations where the poor and marginalized don't have power? And you may be the only representative they're going to see for a while, that you can try and clarify to people who are not thinking much about it, about the power dynamics and what the power dynamics can mean. That we're talking about mental health, and then of course what that means for mental health. And so we do have to move beyond identifying these particular groups to figuring out our responsibilities as researchers, as people who implement various projects to help reduce those inequities, not just in the project, but in the long term.
Yeah, maybe now we can segue to probably a really pressing question for a lot of people in the room that's related, but what can you speak on the current research for potential solutions to the negative mental health effects of climate change? So thinking here about a range of things, but in particular, maybe buffers from exposure to natural effects of climate change. And Greg, maybe you could start us off on this one.
Okay, I'll go quick because I want to hear from others. I sort of touched on a bit of how I think about that with urban heat island effect, air pollution. And then the question that I think the nature and health field really needs to wrestle with is, to what degree are, say, the stress reducing impacts of nature contact relevant to the challenges of climate change, and in what context? So for instance, we recently collaborated with Dr. Nicole Arrett at the School of Public Health and many others on a community-based and speaking to the point about, you know, working with communities, green intervention that would develop a nature-based therapy for a community in California that had just experienced a highly traumatic event of the campfire, which was very deadly and destructive. And working with that community who had a traumatic set of lived experiences and seeing the degree to which forest bathing and a nature-based therapy was or wasn't helpful to that community, given that recent trauma. And so it's an ongoing set of questions, but it really informs how nature health needs to think about the impacts of climate change, kind of coming into a community and working with them and their lived experiences that they've had due to the events that stem directly from climate change. How does that moderate or change the effects of something like nature-based therapy for people who, you know, reported having broken and damaged relationships with the environment because of climate change? So those are some new research and practical applications that I think the field needs to address.
Yeah, I could comment on this. I like to think of it as three different levels. First, mitigating the impacts of climate change, and reducing the extent of climate change is going to have a positive mental health impact. And I think we don't want to lose focus on that idea that let's make it less bad. But also then, given that we're certainly not going to eliminate climate change, we need to provide people with the tools to cope with some of the effects that they're going to encounter, and then really to in a more proactive way provide people with opportunities and tools to be resilient and adaptive to the kinds of changes they're going to encounter. And so all of these really can benefit mental health by, again, not just reducing the impacts, but also helping people to feel less helpless, less overlooked, less ignored. And this is the thing about mental health. It's mediated by your own perceptions of the event in a way. So if you think climate change is happening, it's terrible, there's nothing I can do about it, that's going to lead to one kind of mental health impacts. If you think climate change is happening, it's terrible, I can get engaged in the efforts to reduce these impacts. That's very empowering, and that can be very beneficial for mental health. Also, the opportunity to come together with other people and organize and work with groups tends to have a positive impact, and just helping people to understand the problem so they can feel more in control cognitively and learn how to prepare. So yeah, maybe I'll stop there, but thinking about that, well, let me say one more thing, that these are, I'm focusing on sort of individual level reactions and responses, but we need systems in place that provide these opportunities, that provide the education so that people can be informed, provide them the opportunities to come together, provide the opportunities to get involved. And education, not just about climate change, but about how to adapt and how to cope at a psychological level.
And if I could jump in and I guess build on where Susan left off, and also talk about emergency response. When I moved to Alberta, I didn't know that wildfire season was a thing. And I have also learned that there's lots of really great research showing how the wildfire activity in this part of Canada is definitely influenced by climate change. And so even in a place like Canada, where we have, universal healthcare coverage that's free, mental health still isn't integrated into the emergency response as well as it should be. We saw that in the Fort McMurray wildfires that Chris had mentioned earlier on. And there's a ton of research that came out of those fires showing the long-term impacts that had on people who had to evacuate. So that included everything from, like PTSD and depression, to even like cognitive development of children and IQ tests and things like that, even years later. So these are like really serious long-term impacts from being evacuated. And you would think that we learned a lot from that wildfire activity, but then just this past summer, the city of Yellowknife had to be evacuated. And again, we see these impacts happening. And this also speaks to the equity question that you had asked earlier. You have some people who might be more affluent or have more access to resources or have more extended social networks that were able to relocate temporarily, no problem. For some people, like I saw on social media, it was like described like a mini vacation going somewhere. And then on the opposite end of the spectrum, you have some people who don't have that social support system and family members missing, that they don't know where they are, what center they ended up in, and the mental health stresses of that. And the mental health implications of that, I guess what I'm trying to say is they need to be more systematically integrated into the response in a way that they aren't right now. And I think that's because of a lot of different reasons. But we have research showing the long-term implications of that for a number of different mental health outcomes.
Time for questions from the audience. So I'll just end this portion of the Q&A by asking what you think the most ripe avenues for future research are in this area, or maybe some underexplored areas of research that you would be excited to see more of in the future. This is open to you.
I'm happy to start on that. We just don't have data. And there are, as you'll hear from others, so many research questions. The real challenge is trying to get the data. And that's been noted at the UN level, from UN DRR, through a whole range of other UN organizations, to national, to subnational. And it goes to some of the questions in the chat. We desperately need to be collecting data to answer some of these questions. Thanks.
Yeah, if I could just follow up on that, I was going to say we need to describe the effects more fully. So essentially, just to echo what Chris just said, to describe the impacts of climate change on mental health, we need to think creatively about what are the different ways in which mental health can be affected. And again, the framework I introduced at the beginning, it didn't occur to people until relatively recently that some of these channels would have an impact, that that heat could affect mental health doesn't occur to people, where there's very good evidence of that, but still very preliminary. We're just beginning to get, I'm aware of only a few studies that have looked at some of the actual neurological impacts of the stress associated with experiencing a major storm or wildfire, for example. So to think more about the ways in which climate change can affect mental health, and then actually collect the data that tells us how much, to what extent that's happening and who it's happening to.
And I have to jump in again. I can't resist because my group has done some systematic literature reviews on this very topic. And so the research that does exist tends to be looking at what's happened in the past, so how different events or climate change has impacted mental health in the past decade or two. There's incredibly very few studies that look at projections, how those how we're expecting to see things change under different climate change scenarios into the future. Most research focuses on impacts. Very little research focuses on adaptation. So what responses, some of the examples that were given, forest bathing and some of the examples in the chat, we don't know the effectiveness of that. We don't know the feasibility of some of those things. More work needs to be done looking at that specifically through a climate change lens. And also co-benefits. So things like one of our panelists in the room was talking about, access to green space and blue space. More work needs to be done on that as well. And then finally, where research is done is incredibly inequitable. And actually, Chris wrote a really great paper on this. I'm talking about, we know a lot more in cities than rural areas. We know a lot more about high-income countries than low-income countries. And yeah, where research is coming from is also very unevenly distributed in the literature.
An addendum I'll add to that is we have to better understand how to counter misinformation. And the misinformation comes from all directions. There's been quite a lot of email traffic in my inbox about a paper that came out about the collapse of the major circulation in the Atlantic, which was misinterpreted. It's received lots of media attention. It's causing angst amongst people, and it just hasn't been portrayed accurately. And making sure that as we talk about the various risks, and some of them are quite disastrous, that it's done in a way that is accurate, it's fair, and people understand that we're talking not just about the risk, but also, as Sherilee and Susan talked about, what we can do about it. We're not helpless. And to continue to underscore the point that when you look at previous issues, big environmental issues, traditionally what happened is we didn't know we had an issue until people died. And we started counting the bodies, and then we went back to look for how come there's bodies. And now we have lots of information that can be used to ensure that we avoid some of the risks that are projected, and should be an incentive for making changes and help people understand you need to look at how we can use this information in a way that will improve human health and well-being.
I was just gonna say one quick thing about the work that I do, I think, is closing the loop. So we've done a lot of work in environmental psychology on the ways in which nature contact might benefit our emotional and psychological well-being. But then how do we take that information and think about pro-environmental behavior and support for climate change policy and decision-making? And that is less studied in my work. But there's a connection there, one would hope and think, of increased nature contact and perhaps the connection and association of that with pro-environmental behavior and support for climate change policy. But it's an open question for my field.
I echo everything that's been said already, but I really think focusing on solutions that acknowledge or co-benefits of mitigation and adaptation. And in particular, asking, putting in your hands, asking yourself questions about, is this mitigation, does it have, how disruptive, or who is it gonna benefit? Who's going to benefit from this particular mitigative approach? Who is going to benefit from this adaptive approach? Because given our social structures, there are some fast solutions that are being proposed that actually will not be equally distributed in their benefits, and may not even have that much of a strong climate benefit, but they may have a very powerful economic benefit for some people. And I think that it's super important to keep that in mind, and you can ask those questions. You have it in your power as students to ask yourself, how can we approach this? How can we come up with criteria that prioritize mitigative and adaptive processes that are, equally accessible and available to everyone that's most impacted.
Great. So I want to open things up to the audience to ask questions, both in the room and online. Maybe Leah, you can field the online. Yeah, that'd be great. So if you have a question in the room, feel free to raise your hand. Yes.
Thank you so much for the talk. It was really lovely to hear all of your guys' work and
Sorry, I think that they need this so they can hear you.
sure, of course. I was just saying thank you so much for the talk. It was really great to kind of get that illuminating perspective from all of you on your research. My question is, how do you elevate the voices of marginalized communities that are prone to, deep impacts of climate change, and make sure those narratives are being prioritized in comparison to affluent communities who might have resources and tools to cope better and actually move forward with dealing with climate change?
I'll speak personally, I just continue to point it out and take every opportunity I have to make sure that I bring forward that there are other people, other communities that are being affected, and to make sure that whatever choices are made. So I work on early warning systems a lot and spend a considerable amount of effort pointing out implicit assumptions. People implicitly assume they're going to get to some kind of shelter, buy a car. Well, no, that's not true. That's not true even for high-income millennials who opt not to own automobiles. And so you have to be much more thoughtful and push people on their implicit assumptions to make sure that you bring that information forward. And that's our role as researchers. We're not the decision makers here, but we do have a role to make sure we bring that forward.
And I think for me and my work, first I find the exact same thing as Chris. It's like I'm constantly talking about it, especially in climate change science circles. People get really excited about the science or, like about whatever, but sometimes I find myself reminding people that like people live in the Arctic. Like there are people who live there. Like this isn't just like an ice and polar bear issue. This is like humans live there, and this is like, what they're experiencing. And then in terms of how to try and like make sure that those voices are heard, one thing that I've been trying to do in my collaborative research with communities is trying to work towards some form of self-determination in the research process itself, so that the communities are the ones who are directing the questions, the research. They're the ones helping figuring out how to communicate those results. And even the same thing in the IPCC process, trying to figure out how there can be some form of Indigenous self-determination in the science assessment process itself too.
If I could briefly follow up with Sherilee's comments with an example. I wrote a paper with a group of colleagues on detection and attribution. And as part of that paper, one of our case studies was looking at the melting of the ice roads in the Arctic. There was significant pushback from some of the reviewers and from the editors that the numbers were small, and they wanted to remove this from the paper. And I pointed out that 3 people affected out of a community of 100 is a lot. And you have to think clearly here about what scale you're trying to make a difference at. And for those communities, having 3 people affected, having your spouse go through ice that the elders can no longer determine is too thin because of so many changes in the Arctic, it's critically important. And so the numbers are small, they're still really important. And as Sherilee said, you just find all these opportunities then to push back and point out that at the scale of individuals, the scale of the under-resourced, the marginalized, there's different kinds of considerations and different kinds of metrics that we use to measure our effectiveness and the way we can bring information forward.
We have so many questions, and I'm wondering if maybe we can, our panelists might be able to respond to some through writing at some point. But there was a question online early on, curious if hurricane impacted communities are returning after displacement or whether it's really reflecting disaster capitalism, like if those communities are being gentrified in the wake of hurricanes. Yeah, are you tracking individuals or population level?
Nate, it's a great question, and the answer is what you'd expect from me, which is there's no money to do this. When you look at the amount of research in the United States for climate change and health, it is such a small fraction until the new strategy that NIH came out with climate change and health. The funding for all of the issues in climate change and health has been running less than 0.02% of the NIH budget. Just let that sink in. Almost all of that research, as Sherilee said, has been on heat. There just isn't the money. Do we want to do it? Absolutely. Can you get the funders to pay attention to this? Shirley's going, no. It's just like, there's the crux of the matter. There's so many questions we would all like to be able to answer that we all know are really important. And until there is serious investment into these, we're not going to be able to answer them.
And I just have to add to that too, because in a Canadian context, it's the same thing. And I find it so frustrating because there's so much what I would call like soft support around it. You know, like you talk to people in decision-making positions and they're like, yes, that's so important. You're doing such great work. This is so exciting. And like genuine responses, like they're very excited about it. They think it's really important. They personally really care about it. And then nothing. And it's so frustrating. And I don't know what the answer is, but it's just the same thing over and over and over again. And you know, now I'm getting increasingly cynical and I get, you know, asked to have like meetings with this director or this whatever. And I just know that there's going to be lots of enthusiasm and support and then nothing. So I don't know what the answer to that is, but I think that's an important part, like an important problem that we need to figure out.
On the specifics around the study I mentioned around hurricanes and population change, for that particular research, it's at the county level, it's population counts. But so we can't distinguish whether it's replacement, you know, the same people who are coming back or what happens. There are a few data points that do make it possible to suggest that it isn't entirely disaster capitalism. There are a few cases. So one of the challenges, and this goes back to Chris's point about research, a lot of research around climate-related disaster events are very case-based. So we actually don't have systematic analyses of all the fire events and the subsequent consequences of those fire disasters, or all what we were trying to do is pull together all the hurricane events that have happened since 1970, because we suspected that Katrina is driving most of people's imagination around what happens when you get a hurricane event. And in fact, Katrina is off the charts different than every other hurricane event response in our data for the 40 years, 50 years that we have. So it's important that we get data that allows us to look more comprehensively. It is still retrospective, Sherilee, it's not like prospective, but at least we have more cases so that we can, decide, well, there's these kinds of places that get hit by hurricanes. Only occasionally, they respond very differently than places that are hit very frequently by hurricanes. They have very different signals in the data. And that suggests to us there's something else going on. So our next step is to look at by age, population change by age and sex to see what happens after hurricanes. And even in that case, we have very little data. We can't drill down at the subnational level very easily to get detailed, distinct race, age, sex information to even get some hint of what might be happening. So it is a data problem. And, of all places in the United States, you wouldn't think we would have that data problem, but we do. Yeah, do we have any more questions in the room?
Yes. Yeah, I'm curious to hear, thanks so much for your perspectives. I'm curious to hear if anyone's researching kind of the impact of legislation on people's mental health. I know, for instance, after the Inflation Reduction Act was passed, I felt a lot more optimistic, but that's obviously, one country, one piece of legislation. So is anyone kind of looking at that?
I have a not direct, but maybe indirect response to that. So a survey we did a few years ago asked young people around the world in 10 different countries what their perceptions, what their emotional response to climate change was, whether it was affecting their functioning. We also asked how they felt about the way governments were responding. And not surprising, they were very, very negative about governmental response. They said things like, majorities of people said things like, the government is not following the science, the government is not protecting their citizens, et cetera. And correlationally, the more people reported that sense of the government having betrayed them, the more they also tended to report negative emotions and anxiety associated with the climate change. So to flip that, if the governments were actually to do something, there might be a positive impact. I don't know of any studies that have actually looked at positive impacts of specific policies or programs.
So let's see, we had somebody put a question in the Q&A, they were saying they hopped on late, but they wanted to know, they're a public health student, and are interested in how they would get into this research area, not having a mental health background, how they would do this with credibility. Are there specific ways that you all have sought out collaboration across disciplines or stepped into topics you don't have as much experience in?
I will start from the side of climate change and not opine about the mental health part. Do due diligence, understand what climate change is, understand what climate change isn't. That day-to-day weather variability is not climate change. There's any number of courses. I teach 2 courses on climate change and health. There's courses in the College of the Environment about climate change. There's lots of resources on campus where you can understand what the exposures are. And you need to understand the exposures before you engage in any kind of research, whether it's mental health or other issues. And I'm sure Susan and Sherilee have comments about the mental health part.
Yeah, I'll jump in. I mean, I think that climate change is an inherently interdisciplinary, multidisciplinary, transdisciplinary area. Like, I don't think any one discipline can enter this. So I think that just the topic itself requires teams of people bringing different expertise. And so I think you definitely can work in this area without a psychology background, because everyone brings an important perspective to solve this very complicated problem. And I'm in a school of public health, and public health skills are incredibly important for this. Like, I think that like mental health through a public health lens, or like public mental health, I guess, is really needed right now. So I think that, yeah, just because you don't have I read the question in the chat and I specifically about not having a degree in psychology or psychiatry, I really don't think that's needed to be able to work on this. And that's why you work together. I mean, and work on these bigger teams of people who bring different expertise together. So that's what I would say.
Yeah, and I'll just add a couple of sentences to say, I suspect all of us on this panel lacked some important expertise because nobody's been looking at this for very long. There still are not many, if any, training programs particularly focused on this. So take what you do know and then jump in and admit what you don't know. So I'll say, make sure to adopt an attitude of humility. Don't pretend to know more than you do, but find other people, other experts who can fill in the gaps in your own knowledge.
Great, we have time for one more question from the room, if anybody has one. Yes.
Hi there, I'm a research scientist in the health systems department, and I'm working with a group looking at racial disparities in access to addiction treatment before and after COVID. And recently I haven't been in this field at all. I've been mostly in the addiction treatment world. And recently I've just been thinking about, preparing for looking at research, looking at the impact of like climate change events, and its access to addiction treatment, because people who are on methadone treatment have to go in to get treatment every day and multiple times a week. And has anyone looked at the fragility of healthcare services and its impact? I've been seeing some work on Hurricane Katrina, but I wanted to see what your expertise, if you have looked at this, or if other people have looked at this before.
I'm sorry, I missed the first part of that. So it's whether there's a sufficient capacity in healthcare services? The answer to that's no, even without climate change. Sarah?
No, I was gonna say that too. I think Sherilee mentioned it in her comments that when these events happen, there's little attention to the services that people need of any sort, including mental health services. When we've had heat events, like when we had a heat event, I think Chris and I were in several meetings during the summer of several summers ago. And Seattle had no capacity to deal with a heat event at all. They just weren't prepared. They didn't have enough ice. They didn't have enough in the hospitals. They didn't have any emergency shelters. We had no policies. We had no guidance. We had no public health support to help us understand what to do in those circumstances and who should we be most worried about and take care of themselves. So it's a travesty, really.
And I'd add to that, healthcare in the US is obviously insanely complicated. We don't have to go into that discussion. There's a number of follow-up studies from massive flooding events in places like the UK showing that PTSD and anxiety are still above background 3 years after the event. And so thinking about not just the short term, but the long term, how to give people support, trying to deal with really massive events. It's something I know Sherry's working on with Fort McMurray. These are going to scar people's lives and will affect their mental health for many, many years. We don't have enough services as a baseline, and the demand's only going to grow.
And from the addictions part of that question, I don't actually know of any like specific studies on that. Susan, you might know, but I know like anecdotally, even from this last evacuation in Yellowknife this past summer in Canada, that problem existed. Like I know from people who were like in the emergency like response, who like this was a problem and a challenge for sure. So like it exists. Is there research on it? Not that I can think of off the top of my head.
All right, that concludes this panel. I just wanna thank you all for coming here and particularly to our panelists, maybe we could give them a round of applause.